Hi, everyone. I'm Maggie McGrath, editor of ForbesWomen. In the United States, roughly 1 in 7 people are affected by perinatal depression, either during pregnancy or in the first year following childbirth. This means that this mood disorder affects more than 500,000 Americans every year. Yet many of these people fail to get a diagnosis or appropriate treatment for their condition. Joining us now is one founder and one of her investors who are working to change this landscape. I'm talking about Tina Keshani, the co-founder and CEO of Seven Starling, and Jenny Abramson, the founder and managing partner of ReThink Impact, the largest VC firm investing solely in female-led tech companies. Tina and Jenny, thank you so much for joining us.
Thanks so much for having us.
Now, I know we have some news to break later in this conversation, but I want folks to kind of understand the landscape that we're operating in. And so, Tina, I'll start with you. I know Seven Starling was built in part based on your own experience. Can you talk about what your company is and how it works?
Yes, and thanks for having me, Maggie. So Seven Starling is a women's mental health company, and we provide specialized treatment for women going through mental health challenges during their motherhood journey. And for us, that really begins with fertility challenges, pregnancy loss and miscarriage, postpartum, and early parenthood. Today, 1 in 5 women experience a perinatal mood and anxiety disorder. And of those who are diagnosed, we're not even talking about the folks that are not, 75% never get treatment.
Why is it that they're never getting treatment? Is it they're in healthcare deserts? Is it the stigma? What have you found in your work?
Yeah, so first of all, as I said, it's a really common problem. 1 in 5 women are experiencing this, and actually 50% are never diagnosed. Today, a lot of that burden also falls on OB-GYNs who are seeing these patients throughout their pregnancy and postpartum journeys and are trying to navigate them to care. OB-GYNs today are mandated to screen their patients, given how common these conditions are, but only 20% are doing so because they don't have a reliable referral resource for those patients. And so many women are falling through the cracks. Really, the barriers to this are the fact that, one, there's a really major shortage of therapists and mental health providers in the US, and let alone specialized therapists. So that is a big component of it. But many of those therapists also don't accept insurance, and let alone are offering specialized care during this really important time. And that's really what Seven Starling is out there to solve.
Now, Jenny, I know as an editor in the women's space, I get pitched on mental health startups quite a bit. As an investor in women-led tech companies, you've gotten pitched on a lot of mental health companies over the years. You've invested in 1 or 2 before, but can you talk about the landscape as you see and also how Seven Starling stands out in this landscape?
Yeah, no, you're right. We get pitched a lot. And mental health and women's mental health, maternal mental health more specifically, is at crisis levels. And so while we get pitched a lot, it is rare to see a business that deeply understands the data and actually has an approach to that data that is really working. So as Tina said, if less than 20% of pregnant women are actually getting screened for depression, that approach needs to have a screening element as part of it. And, the costs are so high from this, the outcomes are so poor, and there's critically underserved populations. So we really see this at ReThink as a high market failure that is ripe for tech disruption. And I think Seven Starling has that approach with using technology and the human side and approaching it in a way that's fully integrated.
So speaking of technology and the human side, I was poking around the website earlier. Journalistically, I am neither a mother or pregnant or anything like that, but I did see a number of licensed social workers as therapists on this site. It looked like you have a digital component. Tina, can you talk about exactly how this works?
Yeah, absolutely. So we really provide comprehensive women's mental health care, both for our patients and providers, women health providers that send patients to us. And so I'll talk about both. First, our specialized care model is really at the core of everything that we do. It includes both individual and group therapy. That social and community support is so important during this time, and medication management. So when a patient signs up with Seven Starling, they get paired with a one-on-one therapist, their group, and a psychiatric nurse practitioner or psychiatrist that can support their medication needs. Those three pieces combined lead over 90% of our patients to see statistically significant improvement in their depression symptoms, which is absolutely massive. And each of those components play a really important role in that. In addition to our specialized care model, which is treating thousands of our patients, we also partner within the healthcare ecosystem with OB-GYNs around the country across 450 clinics, 40 hospitals to make that care navigation journey so seamless. So we have integrated tech that integrates into our referring providers' systems. It's literally a one-click referral mechanism that gets their patients into care with us. In addition to that, we also provide seamless screening solutions, preventive care and education programs, and care navigation to all of those patients. So we're literally taking on all of those behavioral health workflows for them so they can focus on what they do best.
So you've been growing. You work with, is it 1,500 plus OBGYNs? Is that correct?
Yeah.
And you have some news. So what is the news you're announcing today?
Yes. So we're so excited to share our partnership with ReThink Impact, Jenny and her team. This was really an opportunistic raise for us where we had so much going for the company and we had an opportunity to really accelerate that. So first, we actually just published our first patient outcome study where we share some of the amazing results that we've seen with our patients and really the proven outcomes that our specialized care model drives. We also have now partnering with over 1,500 actively referring OBGYNs across 18 states where we serve patients today. And we have really broad in-network commercial and Medicaid coverage. So we're at this really exciting moment where we have all of these things coming together and we want to make sure that we get our offering out to more women across the country. So part of what we're partnering together on is to continue that national expansion and the footprint that Seven Starling covers, accelerate the amazing tech innovations that we're building to reduce barriers to care even further, and build large-scale partnerships with more plans and health systems around the country.
Jenny, there have been a few numbers thrown around here, but as an investor, I'm wondering which of those numbers spoke to you the most? What's the value proposition for your portfolio in this point in time?
No, I think it was a few things. One, it was this integrated model with OB-GYNs. I think it makes a big difference. Two, the payer relationships. The fact that they already had 100 million lives covered, not to mention the Medicaid coverage in a number of states. For us, that's a huge lift that most companies can't do. And it was critical to getting coverage, 96% of their patients being covered. Three, it was the tech. At the end of the day, we're tech investors, and they use tech and AI in all the right ways. They're using it to do things like verify insurance much more efficiently, so clinicians can then actually focus on the care that they need. And when you coupled all those together, ultimately it was the metrics of success, the 90% of statistical significant clinical outcomes that Tina spoke about, and the fact that 40% of their users had never gotten mental health care until Seven Starling. And I think we looked at all of that, and then we looked at the leaders themselves. And they weren't just Harvard Business School grads who had been at BCG and had big jobs. And in Tina's case at Warby Parker, actually had led payer expansions and led telemedicine expansion nationwide. But they were people who had lived experience with this very issue. And we have found that our entrepreneurs who have gone through something personally and have the business jobs to do it have massive success. So I think it was all of that combined that really made Seven Starling stand out.
Tina, I want to pick up on something Jenny just said that might have been easy for our listeners to overlook, but you and your co-founder have built relationships with a number of the insurance providers in the United States and Medicaid, and up till this point, you had only raised a Series A. Is that correct?
Yes.
How did you do that work? Because I've talked to later stage companies and I ask about insurance integration, and they have sometimes described it to me as a down the road problem, and they might be Series B, C, etc. How do you do that with just Series A funding?
Yeah, I mean, for us, it was a really fundamental component of building this company, and actually moving the needle on our mission. The vast majority of our patients, as Jenny said, 96% use their in-network insurance to get care with us. And we believed from the very founding of our company that one of the main issues and challenges that we're trying to solve is to provide affordable care that every woman deserves as they're going through this really challenging and transformational experience in their lives. So really it was from the very beginning, from when we got our seed funding, that we were doing this. And, you know, we started with just one state and building those relationships. But what I'll tell you is that we've had so much success. We partner with all the national payers. We have national contracts with all of the big insurance plan in the country, so including United Healthcare, Cigna, and many others. And the reason that we've had so much success is that payers understand that this is a massive problem. Number one, poor birth outcomes are some of the most costly elements of our healthcare system. And actually, untreated maternal mental health conditions are a big driver in that. Also, mental health is a huge issue in our country. And so when you combine those two things together, where you have maternal health and mental health, it's really powerful. Today, about $14 billion of avoidable healthcare costs are driven by not solving these issues. And so health plans see this as a massive problem, and they're really excited to partner with us.
And just to put a fine point on it, this round that you're announcing is an $8 million round. Is that correct?
That's right. Yeah. So
what does that
raised,
bring your total funding to?
About $22 million.
And I want to go back to that 14 billion figure. Jenny, you and I have talked about this before. I've talked to other healthcare investors a lot about it can be one small startup, but the potential savings for the healthcare system could be massive. What's the dollar figure that you're looking at if you project out to more women getting treated for their perinatal depression?
Well, just the sort of untreated women right now is 14 billion. And that's like very specific to maternal mental health. When you think about fertility and you think about toddlerhood and you think about sort of all the things that go into suicide being the number one cause of death for women within a year after giving birth, and all the costs that go into that, not just for that specific family, but for the system more broadly, and all of the ER costs, you realize that we're talking, you know, many multiples on that 14 billion when you see this at scale. And we think that Seven Starling is really well positioned to be a category leader in this, and they're already on that path, to your point, with payer relationships and everything else. And the impact is not just a massive business, but is a societal economic impact, because when women suffer, all of society suffers, and the economics are very real there.
Now, you mentioned Medicaid, and we are speaking in a precarious political moment for Medicaid. There are proposed cuts to that program. Does that threaten the growth prospects for this company? I'll pose that question to both of you.
You know, for us, fundamentally, 40% of moms are Medicaid. So it's really about our mission at the very core is in order to solve this problem and really move the needle, we have to be able to support those moms. One of the really unique parts of our program and what makes us, you know, an affordable option and a scalable option for health plans is that we really lean into group. Group is a really core component of what we offer, and it really brings down the cost of care. And actually what we found is that in many Medicaid plans, the rates for group therapy are actually quite good compared to commercial plans. And so we really are leaning into that component and making therapy more accessible, more affordable, and more scalable. So that's one of the ways that we really think about it.
I'd say from an investor standpoint, one, we knew the core business, even if Medicaid weren't involved, was already massive, was already a large enough market opportunity and market failure that alone would justify a business case. Then you couple that with Medicaid, which if you look at most of the legislative changes of the many areas being cut, maternal care is not the first. And it does not seem to be getting quite the attention that some of the areas, because I think there's an understanding on both sides of the aisle that healthy mothers is critical for healthy children and a healthy society. Yeah. And so I think that in this case, the opportunity is even larger than what they've tapped so far.
I would hope that maternal health and healthy families would be a bipartisan issue, but in these divided moments, you just never know. But we're speaking today with this funding announcement. I know it's early days, but if we were to speak a year from now, Tina, what would you hope to report to Forbes about how Seven Starling has grown?
Yes. So our first and foremost, our plan is to expand to more states so we can reach more moms and help more moms get the care that they deserve. So we hope to be in 30 states by the end of next year. And that includes broader commercial and Medicaid coverage. So really continuing to really double down there. We're also going to continue to build really innovative technology that allows us to integrate within the healthcare ecosystem and not outside of it, really partner with more OB-GYNs, more plans, more health systems to reach patients where they are. And that at the core is through technology. And then last but not least, we're really thinking about larger scale partnerships. How can we reach more women and have an even bigger impact by partnering more deeply with plans, and then also partnering more deeply with health systems where many moms are delivering their babies today.
I almost started with this question, but I think it was important to establish the business case and the business fundamentals here. But where does the name for your company come from?
Yes, I love this question. So a starling is a type of bird that is most well known for creating beautiful murmurations in the sky. So if you've ever seen hundreds of birds come together and create these beautiful shapes and formations, that is a murmuration. And they have, there's this really cool rule in nature called the power of seven. These birds stay together by following their seven closest neighbors. We love that visual because for us, what it means as Seven Starling is something bigger yourself and a community. And actually our groups tend to be an average of 7 people. And so it's really not to community, but also this beautiful image that we find to be so powerful.
That is a really lovely image. And the group innovation that you've unlocked here is an interesting way to attack some of the, I guess, care gaps, right? We hear so much about how inaccessible therapy is. And if group therapy is successful for your startup, perhaps we'll start seeing that in other cases. I know I've talked to a few other founders in the mental health space focusing on kids and other patient populations where they're exploring groups. So perhaps we'll be talking more about group therapy in 2026. Jenny, you're nodding.
Oh yeah, we're big believers in this as from an economic standpoint and a results standpoint, and already have companies like Clarity Pediatrics and others who are using this model that we think is hugely impactful. So we think this is the future. And especially when it's partnered with one-on-one care and some of the other things in the maternal space that Tina has spoken about.
We've covered a lot of ground, but final thoughts, anything I missed, anything else the Forbes audience should know about Seven Starling or the mental health crisis for parents in America right now? Yeah,
the last thing I'll say is that for myself and my co-founder, the mission is really personal. For both of us, we've navigated our own mental health struggles as we've both gone on journey to build our families. I am a mom of a young toddler and actually 7 months pregnant with my second. So I am truly living this mission every single day. And I've never been more motivated to build this company so that other moms can have access to our services and believe so deeply in what we're doing. So it's both fulfilling from an impact perspective, but also from a personal perspective, being a mom in today's world.
And we just couldn't be more excited to be backing Tina and Sophia and this critical issue and massive opportunity. And I think we've seen it in our own portfolio in Spring Health. We've seen it in educational equity. We've seen it in so many areas that are ripe for disruption, and that there's no better entrepreneur to do it than the one who's experienced it firsthand and has the business chops to do it at scale. So we couldn't be more excited for Seven Starling.
Tina Keshani, Jenny Abramson, thank you so much for sitting down with Forbes and sharing this news with us. We really appreciate your time and your insight.
Thanks so much for having us.
Thank you, Maggie. Always good to see you.